Hi, I'm Brian. Today is Tuesday, May 19th, and yesterday on Monday I had my cochlear implant surgery. So today I want to talk to you about what was going on leading up to surgery, how the whole process went, and what you can expect when your time comes. And I also want to talk to you about what I learned that I did not give much thought to prior to this. So, when I was going in for surgery the night before and actually driving in the car, I was thinking about a past surgical procedure I had, a stapes operation years ago. And that ran into some complications. So I was thinking about that, obviously. You know, that's one experience that you'll never forget. And today, also was thinking about mask. Everyone's wear masks now, and if you're like me and your main mode of communication is lip reading, it's very difficult to communicate with people. And so I was hoping that my wife, when she brought me in to the surgical center yesterday, that they were going to allow her into the facility so she could help me. Unfortunately, they did. So my wife was able to get all of the admission paperwork completed, and that was a big relief to me. She was able to sit with me for a few minutes before I was actually called in to the pre-surgical area. At that time, we had to part ways, and I went into the pre-surgical area, and of course, everyone had masks on. They left the clothes on the stretcher for me that I had to put on. I got changed, and then when they opened up the curtain, again, everyone had masks on, but then I was approached by an individual who didn't have a mask on, and it turns out he was my anesthesiologist. He adhered to the 6 feet, safety distance, and I informed him right away that, I'm a lip reader, and that if I do have to ask you to repeat yourself, I apologize. And he made me feel very calm, and he just said that's not a problem. So he asked me the general past history medical questions, and that literally took about 10 minutes. And when he was finished, he made it a point to say that you lip read very well. And so I kind of said to him, but it's amazing what you learn when you have to survive. And so he smiled at me and winked, and I knew it was a wink of acknowledgement, and I was very pleased with that. So he put me at immediate ease, and so I laid there for a few minutes, and then the next thing I knew, I was brought over to the surgical suite itself. I transferred over to another stretcher, and they put a blanket on me to keep me warm. And the next thing I knew, I was I felt a burning sensation in my hand. They were giving me some type of sedative or solution, and that's the last thing I remember. So the surgery itself took place, and then when I was in recovery, when I opened up my eyes, the first person I saw was my doctor, and who better, right? And again, he had a mask on, so I couldn't really, he didn't even bother to talk. He knows I couldn't hear, and that I'm a lip reader. But as I told my wife, his eyes said it all, that he had that look in his eyes that everything went well, and he gave me a thumbs up sign. So I was very pleased about that. And then immediately, as he turned around to walk away, I did have some discomfort, and right behind him, who approached me, was my nurse, and she had some paper, basically identifying some questions and if I was in pain, and I said yes, I was, and she gave me some medicine right away, and the pain was gone pretty soon. Very shortly thereafter, my wife was allowed to come bedside, and she was able to do all the discharge paperwork with the nurse that was there, and that was a big help as well. I got changed back into my street clothes, and then what we did is we drove over to my surgeon's office, who happened to be down the street from where the surgical center was, and they wanted to do a quick CAT scan to make sure they had correct placement of the implant and the cochlear apparatus itself. And that only took a few minutes. We were in and out of there. I was home probably about 11 o'clock. I arrived at the surgical center about 6 o'clock, and I would say that the surgery started about 7 and took about 2 hours. As soon as I got home, I got changed. I went to bed. I woke up about 3 o'clock, and I did have a headache, and I took some aspirin, but that took care of that. So what I noticed about this is a few things. Number one is tinnitus. I've had tinnitus since I lost my hearing back in 1995, and it's always been the same pitch, the same screechy, scratchy sound, and sometimes it's louder in one ear or the other. But I noticed this time that there was a change in the frequency of it and the loudness on a few occasions, but then it really kind of settled down. It was back to the tinnitus I was used to. The other thing I noticed when I would stand up with the assistance of my wife, if I had to, go to the bathroom or whatever, I noticed that I did have some lightheadedness and some dizziness. But after I took a few steps, it kind of dissipated. But whenever I stood up for the first time on a few occasions, that's what I experienced. I also noticed that, obviously the surgery was on my right ear, that I had some tenderness on the right side of my neck and on my jaw, and so I couldn't eat anything hard. I was really limited to eating soup yesterday. And the other thing I also noticed, with this protective covering on, it also has packing in there, is that when you change positions, when I would sit perpendicular or up in bed, that it seemed to be drainage more. And the other thing that we kind of didn't anticipate until the last minute, that a day before the surgery, 2 days before the surgery, we received a text message that I had to go to the surgical center where the procedure was performed, and that I needed to get a COVID-19 test.
Take the mask off.
Take the mask off.
Off or the off?
Either. Okay. So this goes to the back of the nose, and it burns.
It goes in the back of your nose and it burns.
Oh, that's great. Okay.
Then we just ask that, you leave here and it goes home and doesn't go anywhere until the procedure.
And then after, when you leave, don't go anywhere. Self-isolate.
Sorry.
Is that the actual surgery itself? When's the activation date?
Be safe.
Thank you.
Bye.
You too.
So fortunately, I was able to bring my daughter, Sir Madison, with me, because I know everyone was going to have a mask on, and sure enough, they did. So my Madison came with me. She was in the passenger seat, and she was able to lower her mask so I could read her lips to follow the instructions. We never had to get out of the car. We drove right up through the walkway there at the entrance to the building. They came out, they swabbed my nose right there while I was sitting in the car. It was literally a 3 to 4 minute process. They were very, very nice. And that's it. And I hope, you find this information useful. I know if you're thinking about a cochlear implant, it's a big decision to make, but it's something that I believe you're going to benefit from. Later on today, my wife's going to help me. I'm allowed to take this off today and change the dressing, and we're probably going to do a video on that as well so you can see that process. I can't see it. Right, move the ear. Okay. Thank you. Thanks for watching.